Hey guys, today I want to make a quick video to review what we have been talking about as far as nutrition in the past couple of days. First, let me start by saying, first of all, as by way of introduction, I am Dr. Ketchy. Nice to meet you all. So, quickly onto the topic. As far as eating and diets, first of all, one of the common myths that women say and hear is that when they are pregnant, they are eating for two. No, ma'am. No, you are not. You are not. If anything at all, you're eating for like one and like maybe one in a third of fraction. But let's not get too caught on the fractions. I'm just going to say this very quickly. In the first trimester of pregnancy, which is the first 13 weeks of your pregnancy, your dietary recommendation is not any different from when you are not pregnant. Okay? In the second trimester, which is from like 14 weeks to about 26 weeks, you only have to increase your dietary requirements by like 340 kilocalories per day. In the third trimester, you should be increasing that by 450 kilocalories per day. Of course, that's an approximate number, and these numbers are different for patients who are pregnant with twins, triplets, and the higher order numbers. And if you have any questions or you want those numbers, you can DM me or write in the comment sections and I'll respond to you directly. Now, to wrap up quickly as far as diet, let me say this. As far as any dietary regimen that you may be on prior to pregnancy or during pregnancy, if it's tipping you into ketosis or you're producing high numbers of ketones or even any ketones, it is not necessarily good for your pregnancy because we have seen from research that ketones can affect how your baby's brain develop and not in a good way. Okay, so therefore, what should you avoid? Avoid food that is high in sodium, avoid added sugars, avoid solid fat in your diet. In addition, also avoid any food that contains empty calories. Speaking of empty calories, avoid alcohol while you're pregnant. There hasn't been any research that has shown how much alcohol is safe in pregnancy. So what I would say is, by any means necessary, avoid drinking any amount of alcohol during pregnancy. And this is not for you to beat up yourself. If you were drinking before you realized you were pregnant, you could stop from now moving forward. Okay? Then going on to coffee. To my friends who like to drink coffee. Caffeine crosses the placenta, therefore it can get to your baby. Now, what we have seen as far as study and research is that it can affect, because we have mostly looked at how it affects the growth of your baby. It can affect the growth of your baby, and by that we only recommend that you drink at most 200 milligrams of coffee in a day. Now, how you want to do that, or how you want to separate that, or divide that up for the entire day, it doesn't really matter, whatever keeps you going, but do not consume any more than 200 milligrams of caffeine in a day while you're pregnant. And I'm saying more specifically while you're pregnant because outside of pregnancy, the lines are a little blurry as far as how much caffeine or how much anything else that you can eat. But I will always say, as a general rule, everything should be done in moderation. Avoid too little and avoid too much. Back to pregnancy. What else are we going to talk about today? Supplementations. So I would always recommend, that most OBGYNs will recommend you starting to take your prenatal vitamins at least up to a month prior to your conceiving the pregnancy. Now, majority of all patients who are pregnant do not necessarily plan their pregnancy. Therefore, I would recommend that once you're within the reproductive age, you should start taking your prenatal vitamins as much as you can. This is mostly because of the folic acid, of course, and all the other micronutrients in it. But as many of you may know, folic acid has been implicated to a large extent as far as reducing the risk of having what we call open neural tube defects, or in the cases whereby some babies are born and the spine over their backs is open, over their back, and the spine is open, or they have a cleft lip and palate. folic acid has been shown to reduce that, especially if you're living in a country where it's not supplemented in like your bread and your cereal. So you should always start to take that for its benefit. In addition to that folic acid in pregnancy, what you also want to have is the iron. Now, you'd need about 30 milligrams of iron per day, which is almost always the same amount that you would find in any prenatal vitamins. So it doesn't matter what brand. The other thing that people are, the other more common thing you're looking for in your prenatal vitamins is DHA. This is basically, in a very simple term, fish oil. Okay, there are different types, but mostly the omega-3 fish oils. You need at least 200 milligrams of DHA in your prenatal vitamins. Anything more than that hasn't been shown to be any more beneficial than the 200 milligrams. But let me summarize this and say, nothing against any brand or anything like that, but they are not much different. It doesn't matter what brand it is, if it's over the store brand or whatever it is, but most prenatal vitamins tend to have the same thing, so it doesn't really matter. You don't have to pay too high a price for it. That will be a great segue for us to talk about fish as far as actual eating fish in pregnancy. Fish is good for its protein and the other nutrients that it has, but what we are particular about is how much fish you're eating and what type of fish you're eating in pregnancy. You should, by any means necessary, avoid the fishes that contain high mercury, such as king mackerel, the tuna, swordfish, and there are many other types as well. Wild fish, like I said, let me say this again, is very healthy and recommended in pregnancy. There are 3 types of fish that we have described: the best choice, the good choice, and the choice to avoid. The choice to avoid are the ones, like I said, that have high mercury content. The best ones, you could have up to 8 to 12 ounces in a week. That's fine. For the good choice fishes, you can have up to 6 ounces in a week. But the ones you should avoid, avoid them during pregnancy, because the mercury content it is not safe for your pregnancy. I'm going to stop here. It's been a pleasure. I want to make this quick so we're not all bogged down by a lecture of some sort. But I am here. If you have any questions, you can DM me or put in the comment section, and I'll do my best. I will definitely get back to your comments and answer all the questions that you may have. The point of all this is for us to stay healthy and have a healthy pregnancy outcome for both the mother and the baby. Thank you for listening, and have a good day.